Hi, I'm Brandon, a physical therapist at Heartland Orthopedic Specialists, a department of Douglas County Hospital. Today we're going to be covering approved exercises for our total hip and total knee joint replacement camps. These exercises are important for helping regain strength, range of motion, and reducing symptoms prior to surgery, and will help speed up the recovery process after the surgery. If at any point doing these exercises produce sharp, shooting, stabbing pains, please stop doing the exercise and consult a physician or a physical therapist if needed. We're going to start by bringing the toes and the feet up towards the ceiling, push the foot and the toes away from you, and then repeat at a nice, quick pace to aid in increasing blood flow, circulation, and helping to reduce your risk of blood clots. Here we're going to start by placing a towel roll directly underneath the knee. We want you to push down into the towel roll, tightening up your thigh muscle. Hold for 5 seconds, and after the 5 seconds, then relax, and then repeat. Here we're going to start by squeezing your buttocks together. Squeeze nice and tight. Hold for 5 seconds. After the 5 seconds, then relax. When you're doing this on a firm surface, you should see the hips coming up slightly off of the table. For this one here, what we want to do is start off by first sliding over a little bit to give yourself adequate room on the bed. We're going to slide the leg out just as far as you're comfortable, and then slide the leg back in again, making sure that you keep both your knee and your foot pointing up towards the ceiling, not rotating out to the side. Just at a nice steady pace. You do not need to hold, but just back and forth. If you have difficulty sliding the leg on the bed, place a plastic sheet, a sheet of cardboard, or a cookie sheet underneath your leg to help reduce the friction. Now we're going to slide our heel up towards the buttocks as far as what you're comfortable, and then slide back down, holding for 5 seconds when you get towards the top. Again, with this one, if you're having difficulty or there's too much friction on the bed sheet underneath the heel, feel free to put down a sheet of plastic, sheet of cardboard, or a cookie sheet. For the short arc quads, we're going to place a bolster underneath the knee. This is something that we're looking for about 6 to 8 inches in diameter. Things that you could use for this at home would include rolled up blankets, rolled up pillows, cylindrical Tupperware, coffee cans, anything that's approximately this size. We're going to keep the back of the knee on the bolster throughout the exercise. We're going to extend the knee, kicking your foot up towards the ceiling, tightening your thigh muscle, and holding for 5 seconds. For the long arc quads, we're going to be sitting in a chair with your knees back as far as you can get towards the edge of the chair. Sitting up nice and tall with good posture, chest up, shoulders back. We're going to kick out the leg, extending at the knee, bringing the foot up towards the ceiling, tightening the thigh muscle and holding for 5 seconds. For this one, try and keep your foot relaxed as you kick the leg up towards the ceiling. For the mini squat, we're going to be standing next to a counter, kitchen sink, something that's going to be nice and sturdy to help with balance. The feet should be shoulder width apart with your toes pointing just slightly out to the side. We're going to squat down now partially, sticking the buttocks out as if you were going to be sitting into a chair, keeping the knees above the toes. We want to make sure that the knees do not go out in front of your toes. You want to make sure that you have good posture, so again, chest up, shoulders back as we do this exercise, and looking up and out in front of you, promoting good cervical posture. Keep your weight symmetrical between the left and the right leg as you go up and down. For the marching, we're again going to be next to a sturdy object, making sure that you have good balance and safety throughout the exercise. We're going to be bringing the knees up as high as you're comfortable. If you're a total hip patient, making sure that you're not breaking a precaution of going past 90 degrees of hip flexion. Try to make sure that you keep your foot directly underneath your hips as you bring the knee up, and repeat.